Today we're going to do part 2 in our 3-part series about teeth whitening, so roll that intro. What's up everyone, Dr. Eric Jackson here. Let's begin part 2 of our teeth whitening series. In part 1 we kind of touched on the nuts and bolts of teeth whitening in general, reasons why you might want to whiten your teeth. Does it have bleach in it? Because it's often called bleaching. No, the answer is no, by the way. And what it does contain. And then ultimately, the general classifications of gel, toothpastes, and rinses that are out there on the market today. But for part 2, what we're going to talk about is more of a patient-centric, patient-focused discussion. The things that I tell my patients when they're getting ready, if they're deciding on whitening, when we're going through what whitening works best for them, what their modality is going to be, we talk about expectations and patient responsibility. Now, a lot of dentistry, there's actually minimal live responsibility for patients. There's always some, you have to open your mouth, you have to, not be on your phone texting when the drill's in your mouth, putting a filling in. There is always some responsibility. However, when there's other parts of dentistry, whitening, Invisalign, a lot of active participation where the treatment is truly dependent on the patient's participation and quality of participation. Whitening is probably at the top of that list, if not top 3. Why is that? Well, patient responsibility, right? Whitening is not the same for everyone, right? Different genetics, different enamel density, different ability for the teeth to uptake. There's also different sensitivity levels of teeth. Some teeth are very sensitive or not. People have very busy lives these days, probably always, frankly, but in general, the last few years, it seems like just everything's becoming more and more frenetic in society and in daily life. So following the directions either on the packaging or given to you by your dental professionals is of utmost importance. It always amazes me how people look almost dumbfounded when you have to tell them, well, this is how you do it. And they were just under the impression, usually, and it's not their fault, they're under the impression that, you just put in some magic gel or you put the special strip on there and things kind of just do their own. It's not autopilot. You have to follow directions. You have to wear it for the amount of time. You have to try to really push that envelope as much as you can without causing problems for yourself, dentally, or even in general in your life. We want to make sure that we're not, always do no harm, right? So patient has to wear it as much as possible to get the best result. They have to be using the right technology. They have to have the right mindset. And all this comes into play with part number 2, expectations, right? So how white is white? What is white teeth? What's a white smile? It's very subjective. People have different opinions as far as how to answer that question. Just like, are your teeth straight enough? Are your teeth textbook perfect? Odds are probably not. Even if you've had orthodontics, even if you recently had orthodontics, they sometimes shift, they sometimes have, and the further away you go from that, the more likely that is to happen. The same with whitening. How white are your teeth? Well, some people will say, you know what, my teeth are just fine. I don't even want whitening. Amen to that. No problem. Other people will say, if my teeth don't match my bathtub, I am going to be disappointed forever. That is the other end of the spectrum, obviously, but more power to you. We'll talk about the pros and cons to both and kind of just help that patient navigate through. Now, most patients fall somewhere in the middle. Now, I practice outside of Chicago, and over the years, I've kind of developed, like we all do in dentistry, or in any profession, really, a bit of a script almost, just a conversation that really seems to kind of flow and hits the points in a nice, discernible way. Part of that discussion, part of that script is always the discussion of Chicago white versus Hollywood white, right? Patients think that, again, along the lines of magic, right? They think they're just going to wear this for a couple minutes and it's going to make them look like a movie star. They always have. This has been a problem with whitening for a long time. And it's something that before you do the whitening, I really advocate that both the patient and the doctor discuss where you're at. You take an initial shade, of course, but really, what are the realistic goals? How far does that patient wish to get in a perfect vacuum? Then you have to also realize, well, you got to dial that back because we don't live in a perfect vacuum. So Chicago white is something I've kind of discussed, where basically it's a healthy white. I have a very similar discussion with my denture patients when we're picking shade selection for our full dentures or for our implant-supported dentures. It kind of comes down to, how white do you want your teeth? Do you want to be a white, more natural teeth, or do you want to truly aim for more Hollywood type white? It depends on where you're at. If you're in Hollywood, if you have a Chicago white smile, which is ever so slightly, in my opinion, typically less white, right? Chicago smile, I talk about it as it's the whitest natural teeth you've got. And then Hollywood smile, I'll say, well, if you want to get the whitest teeth, you might have to talk about laboratory fabricated veneers or crowns or something like that. Rarely, not always, but rarely will you be able to achieve your Hollywood white with pure whitening agents. Some people can do it. The genetics, everything has to be a perfect storm, right? Perfect genetics, perfect wear, perfect case selection, perfect everything else. But the vast majority of people aren't going to achieve Hollywood white in the true sense of Hollywood white without laboratory fabricated restorations. I really try to make sure that they know that and talk about Chicago white. Chicago white is when you walk down the street, excuse me. Chicago white is when you walk down the street and someone says, hey, that person has fantastic looking teeth. Not, that person must have veneers because their teeth are blinding me right now. It's kind of a little more low key, a little more subtle as far as, but still very white, much healthier than the average genetic tooth without whitening. And I think it's really a good way to kind of discuss this whole topic, because if someone needs to be bathtub white, some white strips or some over-the-counter isn't going to get them there, typically. Heck, even some of the in-office type stuff isn't going to get them there, typically. And you don't want to avoid this conversation. You don't want to miss this conversation beforehand and then fall short on the expectations front. So patient responsibility, very important. You got to wear it right. You got to use it right. You got to do your end. But also the doctor has the second other side of that coin is the responsibility of talking about the expectations. Is this right for you? Or should you be talking more about 8 veneers or something along those lines, right? Laboratory fabricated restorations. Thanks so much for watching part 2. In part 3, I'm going to dive a little bit more into the types, the most common types of whitening, over-the-counter, take-home custom trays, and then the in-office power whitening as well. Always thank you so much for watching. I appreciate your viewership so much. If you would like the video, subscribe to the channel. When you do subscribe, hit the bell so that way your phone can be notified whenever we upload a new video direct from YouTube. As always, comment below if you have any ideas, questions, concerns. I love hearing from all the fantastic people who watch on all our different outlets on social media. Thanks so much for watching. I'll see you in part 3. Take care now. Bye-bye.